Hey everyone, and welcome back for another deep dive. Today we're diving into something that I know a lot of you are really curious about. It's acupuncture for chronic lower back pain. And we have a ton of your research requests to get through, from clinical trials to MRI studies, really interesting stuff. So I'm super excited to unpack all of it today with our expert.
Yeah, this is definitely a topic that's generating a real buzz in the medical community lately. And it's no wonder chronic lower back pain is so common, and finding effective long-term solutions, that's something that just a lot of people are really looking for.
Absolutely. It's a huge issue for so many people. So
Yeah.
we've got a lot to cover today. So let's just jump right in. One of the first things that I noticed in the research was about combining acupuncture with, like core exercises. Is that something, have you seen that? What can you tell us about that?
Yeah, absolutely. There's a 2024 systematic review that I saw that I thought was really fascinating. It was published in Frontiers in Medicine, and they analyzed data from, let me see, it was 11 different randomized controlled trials. So pretty significant sample size to be working with. And what they found was that this combined approach of acupuncture plus core exercises led to some pretty significant improvements in pain levels
Yeah.
and overall physical function for people with chronic lower back pain.
Interesting. So it's kind of like a 1-2 punch then. You're sort of targeting the pain from different angles. I like it. But I think before we even get too far into the weeds, it might be helpful to take a step back for a second and just talk about how acupuncture actually works, especially for something like back pain, because I think a lot of people are probably wondering that.
Yeah, for sure.
Mhm.
It can seem a little mysterious, I think, at first glance,
Right.
but there's a very specific method to it. So essentially, acupuncturists target very precise points on the body. These are called acupoints, using these superfine needles.
Okay. Acupoints, got it. But how do they even know where those points are? And then, how does sticking a needle in that specific spot actually, do anything?
Right. So that goes back to the principles of traditional Chinese medicine,
Yeah.
which says that these acupoints, they're located along these specific pathways or meridians in the body. And these meridians are thought to be channels for the flow of qi,
Okay.
which is often translated as vital energy or like life force. Now, the research doesn't really get into the metaphysical aspects of qi or anything like
Yeah.
that, but what they are interested in is the physiological effects of stimulating these points.
Okay. So even if they're not necessarily trying to prove or disprove, the existence of qi, they're seeing tangible results that suggest that something is happening when they do this.
Exactly.
I-
So by stimulating these acupoints, acupuncturists are aiming to restore balance and flow within the body's energy systems,
Mhm.
which in turn can alleviate pain, can reduce inflammation, and even promote healing. And I think the studies that we're looking at today, they offer some really compelling evidence to support this.
That's really interesting. So it's not just about sticking a needle anywhere. It's about finding those very specific points that are going to have an impact.
Absolutely.
Wow.
And it's important to note, these aren't just random points either. They've been meticulously mapped out over literally centuries of practice in traditional Chinese medicine. And
Yeah.
the studies that we're looking at are very deliberate in their methodology. They specify things like the needle size, the depth of insertion, even the sensation that the acupuncturist should be looking for, like a feeling of pressure or tingling that lets them know they've hit the right spot.
Wow. So there's a lot more precision involved than I think people might realize. It's not just about sticking some needles in and hoping for the best.
Exactly.
It's really fascinating.
Mm-hmm.
So speaking of specifics, I noticed that the research also mentions something called the INDES, the Visual Analog Scale,
Mm-hmm.
or EAS, and the Oswestry Disability Index, or ODI. Can you just break those down for us for a second? What are they actually measuring?
Sure. These are basically standardized tools that researchers use to assess pain levels, and then also functional limitations. The VAS, it's essentially a visual scale, usually just a straight line, that patients use to rate their pain intensity. So it's subjective based on the individual's perception of their own pain. And then the ODI, that's a more comprehensive questionnaire. That evaluates how back pain affects a person's ability to perform everyday activities, like walking, dressing themselves, sleeping, stuff like that.
Oh, wow. So they're both measuring different, but really important aspects of living with chronic pain, like the actual subjective experience of pain, but then also the impact it has on your life.
Exactly. And what's exciting is that the studies that we're looking at show improvements in both areas when acupuncture is combined with core exercises.
That's great. That's really promising. Now, I know a lot of people are probably wondering, and I'm kind of curious myself, how does acupuncture actually help with pain? Is it just masking the symptoms, or is there something else going on?
That's where things get really interesting. So the research suggests that acupuncture works on multiple levels. And inflammation seems to play a really key role here. Several studies you shared looked at inflammatory markers in the blood, like C-reactive protein or CRP and interleukin-6 or IL-6. These markers are kind of like little red flags that go up when there's inflammation in the body.
Okay, so if those markers are elevated, that means there's inflammation present.
Exactly.
And inflammation, of course, we know is a major contributor to pain.
Exactly.
Got it.
And what they found was that after acupuncture treatments, these inflammatory markers consistently decreased, suggesting that acupuncture may help to reduce inflammation, specifically in the context of lower back pain.
So less inflammation, less pain. That makes sense. But it still feels a little bit like magic to me, like we're sticking needles in one part of the body to affect something that's happening somewhere else entirely.
Right. I know what you mean. It can seem like a little bit of a leap, but that's where things get really interesting.
Yeah.
Acupuncture doesn't just work on that local level of inflammation. It also has this really remarkable impact on the brain itself.
Oh, wow. Really? So you're saying that acupuncture can actually change how our brains perceive pain?
That's right. There was a study using MRI scans to observe brain activity during acupuncture sessions, and they found this really distinct shift in activity within areas of the brain that are associated with processing pain, specifically the prefrontal cortex, which helps us make decisions and regulate our responses, and then also the insula, which plays a really key role in our experience of pain and other bodily sensations.
Interesting. So it's like acupuncture is almost helping to rewire those pain signals so our brains aren't interpreting them as intensely.
Yeah, that's a great way to put it. It's like acupuncture is helping your brain turn down the volume on those pain signals.
That's wild. I love it. So we're only just beginning to understand, I think,
Yeah.
the full complexity of how acupuncture actually works. You mentioned earlier that the research also explored different types of acupuncture. One that I remember seeing was electroacupuncture. Can you tell us a little bit more about what that is?
Yeah, definitely. So electroacupuncture, or EA, it takes those same principles of traditional acupuncture that we were talking about
Hmm.
and just kind of enhances them with a gentle electrical current. So basically, tiny little electrodes are attached to the acupuncture needles,
Hmm.
and they deliver this very mild current to the acupoints.
Okay, so it's not like a jolt of electricity or anything.
No, not at all. It's very subtle. People describe it as a gentle buzzing or tingling.
Okay. And what's the advantage of doing that, of adding that electrical stimulation?
It seems to make the treatment more effective.
Interesting.
Yeah, one study found that EA was particularly effective at triggering the release of endorphins.
Endorphins. Those are our body's natural pain relievers, right? The things that give us that runner's high.
You got it. They have a really powerful analgesic effect. So they help to reduce pain and just promote this feeling of well-being overall. So it seems like electroacupuncture might give the body kind of an extra boost in its natural pain-fighting abilities.
That makes a lot of sense. That's really cool. Now, I'm curious, were there any other types of acupuncture besides electroacupuncture that they looked into?
Yeah, there was one study that I thought was really interesting. It explored something called needle-warming moxibustion.
Needle warming moxibustion. That's a
I
mouthful.
know, right?
What is that?
So moxibustion is another ancient practice within traditional Chinese medicine, and it involves burning dried mugwort, which is a type of herb, near specific acupoints to apply heat. So in needle-warming moxibustion, the burning mugwort is placed directly on top of the inserted acupuncture needles.
Okay, so it's kind of like combining acupuncture with heat therapy then.
Exactly.
Interesting. And what kind of results were they seeing with that?
Well, researchers were particularly interested in its effects on lumbar disc herniation,
Mm-hmm.
which is a really common and often debilitating condition.
Yeah.
And they conducted a meta-analysis,
Okay.
which essentially combines data from multiple studies to give a more comprehensive picture of the treatment's effectiveness.
So it's like a study of studies.
Exactly.
Okay.
And the results were pretty compelling. They found that needle-warming moxibustion outperformed both traditional acupuncture and even traction, which is a common therapy for herniated discs, in terms of reducing pain and improving physical function.
Wow. That's amazing. It seems like this needle warming moxibustion could be a real game changer for people suffering from that.
It's really promising. But of course, more research is always needed. But the results so far are really encouraging.
For sure. So, it's so easy to just get caught up in all these fascinating details, all these different techniques. But I think it's really important to bring it back to our listeners for a second. We have all this incredible research on the potential of acupuncture for back pain. But what advice would you give to someone listening right now who's thinking, okay, this all sounds really promising. Maybe I should try acupuncture for my back pain. What would it be like a good first step?
That's such a good question. And I'm sure a lot of people listening are wondering the same thing. I think the most important thing to remember is that everyone's journey with pain is so unique. And what works wonders for one person might not be the perfect fit for another. So approaching this with a sense of curiosity and a real openness to exploring different options, that's key.
So don't be afraid to just kind of try things out and see what works for you.
Exactly. And don't get discouraged if one approach doesn't give you those results right away. Finding the right practitioner, finding that ideal combination of treatments. Sometimes that involves a little bit of trial and error. Remember, these studies provide amazing insights, a really strong foundation, but they don't replace the expertise and the guidance of a qualified healthcare professional.
Okay. So the research is kind of a starting point, but it's important to have that personalized guidance as well. Speaking of which, what should people keep in mind when they're searching for an acupuncturist? Do you have any tips for finding the right fit?
Yeah, I mean, so many people find relief through like recommendations from friends and family. But for some reason with acupuncture, it feels like finding the right practitioner is maybe even more important because it's such a personalized approach. So what would you recommend? Like what should people look for? Yeah, for sure. That personal connection can make all the difference. Obviously, checking credentials is always a good idea, just making sure that they're licensed and, you know, experienced in treating chronic pain, specifically back pain in this case. But even beyond that, I always encourage people to dig a little deeper.
Okay, how do you do that?
Well, reading reviews from other patients can be super helpful. It just kind of gives you a sense of their approach and how they interact with their patients. And honestly, don't be afraid to just have a preliminary conversation with a few different practitioners before committing to a treatment plan.
Yeah, that's a great idea. It's kind of like a job interview in a way. You want to make sure that you feel comfortable with their communication style and their approach.
Exactly. And don't forget, your doctor can be a really valuable resource here too. They might have recommendations or be able to offer some insights based on your specific medical history. So
Yeah,
it's always smart to get their perspective as well.
totally. Talk to your doctor. Do your research. Ask questions. Trust your gut. That's great advice. This has been such a fascinating deep dive, honestly. We've gone from like the ancient principles of traditional Chinese medicine to cutting edge research on brain activity and inflammation we've talked about, electroacupuncture, needle warming moxibustion. I feel like I've learned so much.
Me too.
So amazing. What an incredible world we live in. But I think the biggest takeaway for me, and hopefully for everyone listening, is if you are struggling with chronic back pain, acupuncture could be something that's worth exploring.
Absolutely. It's not a magic bullet or anything.
Yep.
And like we were saying, what works for one person might not work for another.
Right.
But the research is really compelling. And for a lot of people, acupuncture offers this really safe and effective and honestly, potentially life-changing approach to managing pain and just reclaiming their quality of life.
Yeah, so well said. And that's what I love about these deep dives, is that they give us the power to really take charge of our own health and explore these different possibilities and then have these really informed conversations with our healthcare providers.
Absolutely. Knowledge is power, right? The more we understand about our bodies and all the different treatment options out there, the more we can make those informed decisions about our health and well-being.
Couldn't agree more. All right, everybody, keep those brains engaged, keep asking questions, keep exploring all those amazing ways to take care of your incredible bodies. We'll see you next time.